especially.
Yeah, good afternoon, gentlemen. And my name is Shegun Adetunji. I'm a generalist, a GP. I would say I'm not a specialist bone doctor. I'm not an orthopedics, but I think we have a degree of experience so that we can discuss how we can deal with arthritis as ethnic minorities and aging group, so that we can live a quality life. First slide. Right. We're talking about arthritis today. So how would we describe arthritis? Osteoarthritis is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. Osteoarthritis happens when the cartilage or other tissues within the joint break down or have a change in their structure. This does, happen because of simple wear and tear of joints. Instead, there's a significant change in the tissue that trigger a breakdown, which usually happens gradually over time. It occurs frequently in hands, hips, knees, and can even occur in the neck and the back, and anywhere else you can find joints in your body. Pain, what are the symptoms? You have pain, aching, stiffness, decrease in range of joint mobility or flexibility. There could be swelling, tenderness. There could be bone spikes, usually seen on imaging, on x-rays. You could feel some grating sensations in your joints, and there could be joint narrowing. Again, that will be visibly seen on radiographic investigations. Next slide, please. Now, how does this happen? You can see from the picture on your right-hand screen, you can see that picture in there that you've got joints all over your body, as it were. Now, for some people, the condition reaches a peak a few years after the symptoms start. We use the word gradual process then. So it's not something that happens suddenly. It does happen over time. It then remains the same or may even improve. Others may find they have several phases of moderate joint pain with improvements in between. So it could flare up, it could wax and wane. The degree of damage to a joint isn't very helpful in predicting how much pain you will have. This is because we all have different pain thresholds and pain, interpretations, as it were. Some people have a lot of pain and mobility problems from a small amount of damage, while others have a lot of damage to the joint but few or no symptoms at all. If you have several osteoarthritis or severe osteoarthritis, you may find some of your daily activities more difficult depending on which joints are affected. More severe osteoarthritis can also make it difficult to sleep. And so you can see the impact this could have. Osteoarthritis causes pain, stiffness, and swelling and will reduce functions and disability. Some people are unable to do daily activities because of the advancing disease state. Next slide, please. Right. I've given you the background of what joints are, what osteoarthritis is, and I've said that it occurs in the joints. How will you describe a joint? A joint is a place or a point where two bones make contact. And when you look at that statement, you can see from the head of from your head down to the toes, you have joints in there. You have bones joining together there. So arthritis could occur from your head to the toes. Joints are classified histologically due to dominant connective tissue present or functionally based on the amount of movement permitted. I'm not going to bore you with this, but again, this could become very significant when we're looking at the impact, because the joints histologic and functional component could determine the impact it has on you. Histologically, you have fibrous joints, you have cartilaginous joints, and you have synovial joints. Synovial joints are joints that are easily movable, and they are there. And also, when we are looking at functional classification of joints, we look at in joint, just like your door, that can open and close. Again, you have joints that could just straighten and then bend. Then you have what we call ball and socket joints. Ball and socket joints will move in different planes, like your shoulder, which you can push up, pull forward, pull backward. And then you have your hip joints, which is equally ball and socket. You have pivot joints and you have ellipsoidal joints. All these joints are within each and every one of us, and they could be impacted with arthritis. I've given you a picture of different joints located on the left hand side of your screen there. You got your hip joint, which is the one above, and then you have your knee joint, which is shown below. And all the components that we mentioned, bones in there, you can see some ligament within, but when those bones begin to, join together, or the cartilage in there, like the meniscus as you see, those things can become, aging or, wearing out, and that's where arthritis begins to occur. Next slide, please. Right. We are 50 and above, and so we're looking at the risk factors that will affect arthritis or that could cause or promote arthritis. There are factors that are modifiable and there are non-modifiable factors. One, your age. I'm afraid we are all above 50 now, and so that is not modifiable. You cannot become 30 again tomorrow. So we are prone to arthritis. Genetic predisposition is there, then sex. It is said that female are more dominant, though we are male on this platform, but again, other things will come in. Ethnicity. We look at you can see the hands that are joined together in there. So risk increases with age. Gender, women are more likely to develop osteoarthritis than men, especially after age of 50. Obesity, that is a very modifiable factor that we can all deal with. Extra weight puts stress on weight-bearing joints, like the hips, the knees. Obesity may have metabolic effects affecting the joints. Genetic susceptibility, as we said, race, Asians have a lower risk. The reason for that, I won't be able to completely devote that on this platform for now, but again, that's what has been documented. Then joint injuries and overuse, meniscal injuries, that is injuries over time. You are involved in an accident before, had a fracture, is healed up, but again, that could cause a problem over time. Or there's when an overuse of those joints, particularly when you're carrying too much weight. And then people with sport injuries, things like that could damage their meniscus, and that prevents with locking of the knee, as well as your knee buckling on you sometimes. Then when you do a lot of kneeling down and squatting, that could put a lot of strain on your knees and could over time cause some damage. Next slide, please. Right. How is it that we could pick up osteoarthritis? Basically, I think the first thing is physical examinations, and oftentimes the patient will tell us, oh, I've got this pain in my knee, which is maybe dull aching pain in there. When I am sometimes it's there when I sit down, or once I start working, it gets better. Or when I'm sitting down, immediately I stand up, I feel the pain first, but immediately I start moving, that improves. So when I wake up first in the morning, I feel a bit of stiffness in and there, but over time, all this improves. So when we do physical examinations, we look at your knee, and then we can determine, oh, yes, there are wear and tear in here. And then we go ahead to determine whether you need further investigations in terms of radiological examinations. And these will look at the bony structures of your joints. And then that will pick up osteophytes, which are spike bones, as we call it in, just spikes in the normal joints, feature suggestive of osteoarthritis. You may have bony spores, like we call it, or you may have cysts in there. And moving forward from that, you could require MRI, particularly if your knee buckles on you or your knee locks. Those could be suggestive of ligamental injury or meniscal injury. And so you might need a more detailed investigations like magnetic resonance imaging to determine that. I must say here that if you go to your doctors and you tell them, oh, I've got knee pain, and then, sometimes it just feel like, I'm unable to work. And the first thing you're thinking about is an MRI. It may be extremely difficult for you. We do MRI if we're looking for something more detailed. Arthritis, if you say your knee buckle on you or locks on you, won't push too far for you to get an MRI. But if you don't hit the right nail, I'm afraid it will be extremely difficult for you to push a doctor to get you an MRI of your knee so soon. The next thing will be an ultrasound. The ultrasound is also very, very useful in determining, injuries to the knee. We can access, tendon injury. We can access cysts in there. There's a lot that could be picked up using an ultrasound. And then we have a, little invasive procedure like arthroscopy, which is a keyhole surgery, which can look into diagnostic as well as treatment. You can use to clear your joint depending on what they think is going on in there. And then the last bit will be a blood test, which may show some inflammatory response because arthritis is an inflammatory process. And there are other forms of arthritis too, which this particular meeting does not attend to today, which may be a focus for the future. Next slide, please. Right, what do we do in managing osteoarthritis? You've been told by your doctor that, oh, well, your knee is becoming aging, you got pain in there, it stirs a little bit. What are things that needs to be done? One, there's a lot of things that could be done, both as self-help and as well as treatment pathway. The first thing is activities. We need to increase our physical activities. I think we've said that on this platform very many times about exercises that could help. Range of movement exercises. These exercises involve taking joints through a range of movements that feels comfortable and then smoothly and gently easing them just a little bit further. That is a range of movement exercise. Then you have strengthening exercises. These are exercises performed against some form of resistance to strengthen the muscles that move and support your joints. You could use light weights, a resistance band, or trying exercises in water. Now you have aerobic exercise. This means any physical activity that raises your heart rate and gets your breathing more heavily. This type of exercise burns off calories, so it can help if you need to lose a bit of weight and reduce the burden on your joints. Walking, cycling, swimming are all activities that will help. Next, and then you have the hydrotherapy or aquatic. This actually is being prescribed by the physiotherapist, and hydrotherapy is a form of therapy that helps a lot. You also can use hydrotherapy within your home. If you soak yourself in lukewarm water for some time when you are to relax yourself, it's quite refreshing. I would recommend it for all of us to use at our spare time. Next slide, please. Right, this is still carrying on. Now, what can we do as individuals, as to help ourselves? Number one, to reduce the burden of the osteoarthritis and also to help improve our quality of life. We have said that there are some factors that are non-modifiable, but there are some that are modifiable. Obesity, it's a very modifiable, factor. And how can we do that? If you're overweight, then losing even a small amount of weight can make a big difference to your symptoms, especially for weight-bearing joints, the hips, the knees, back, and the feet. Now, we've talked about diet here a lot, and I think Chidi will be a very good, I hope is on the platform today. Now, dietary support: avoid red meat, sugars, refined carbohydrates, excessive alcohol, and tobacco. All these can, constitute a problem, not as a direct, but an indirect pathway to activating inflammations within the joints and cause destructive process in the joints. Also avoid cheese and full-fat dairy, which increases inflammations. Now, I need to clarify this. Full-fat dairy, cheese, these are also rich in calcium. And so when we are reading in here that we should avoid full-fat dairy, which will increase inflammations, I think there's a bit of balancing act in here. So we need calcium, for the bones, but we don't need the cytokines that could come with free fat things that would damage our knees. So in moderations, we do need a bit of, dairy products to help with our, calcium and to help with our bone health. Then we need a lot of fluid, which is also a routine normal thing that we normally process. Next slide, please. Now, treatment. Exercises is part of the treatment. We've discussed that, so I'm not going to go through that again. However, there are certain medications that are also important in actually reducing the pain and allow you to do the physical exercise more. And this includes painkillers. We have various types. Most of them we have are available on the counter, the anti-inflammatories and non-anti-inflammatories. Paracetamol is a common one around. Ibuprofen is equally bought on the counter. But I must warn us that we should be very careful taking too much of ibuprofen. One, because of the side effects on your kidneys as well as on your gut. So, but you could use them in moderation to actually take care of pain, so that allow you to do a bit more exercise and improve your joint health. We've talked about exercise therapy. We've talked about, passive exercise, active exercise. All these are also part of the process, which the physiotherapy normally, encourage us to do. You can also Google a lot of these on the website to see exercises. The one you want to strengthen, the one to improve your muscle strength, and the ones to stretch. All these are easily available, on the internet. Now we talk about occupational therapies, which is a specialist field in itself, and this also helps to improve our joint health. As it will tell you, how you can move, how you can sit, things you can do to improve your joint without putting a lot of burden on your joints. Now we have TENS. This is a type of machine that we could use and could help to reduce pain if and when we're already diagnosed with arthritis. Then we go back again to exercise, land and water-based. And then the last bit is intermittent hot and cold compress. This is a local modulation. This is just to help with the inflammation within the joint. Using cold compress mainly. I think when we have any injury like a sprain, we're told to apply cold compress, which is part and parcel of joint management. Next slide, please. Right. Finally, there's a lot going on now with arthritis, and like we've said, it's a heavy burden on the health system. It affects quality of life, and it could actually impair people's progress. So based on that, there are a lot of research and a lot of centers being set up to actually deal with how arthritic problems could be improved upon. One of them is versus arthritis. Is a center, which is in collaboration with some universities, about 5 of them, and it also involves the Center for Sport Research and Exercise. They are based in Oxford, but there's a lot of other universities that are involved: Nottingham, Leeds, Southampton, Bath, and I think about 5 of them in that form that consortium, and they're working actively to ensure that arthritis is looked at holistically to help people improve in their management as well as improve the quality of life and really determine how actually we come about these particular problems of arthritis. Another center is Johns Hopkins. This is based in the US, and they are very, very involved with different form of arthritis equally, both inflammatory arthritis as well as osteoarthritis. And they are trying to look at the management process, the causative process, as well as things that could be done to reduce arthritis. Slide, please. Right, so arthritis is a problem and all of us are prone to it. Please manage your weight, look after your health, good nutrition, good exercise, and we're good to go. Thank you.
Thank you very much, Doctor. Really appreciate it. Before we finish and go to Q&A, just saying that people should not forget, we've got a lot of posting going on LinkedIn by a social media person, and we'd like you to be following on social media and just reposting. Also, please make sure you download the app, the Google and Apple Store, because very soon we'll have no choice but actually to move off the WhatsApp platform. Thank you, everybody, and I'll stop recording now, and then we can go into just chat, Q&A session, etc., etc.